everyone. Hope you all are doing well. I am Sushma Alawat, TGT, Physical and Health Education, Kendriya Vidyalaya, Ordnance Factory, Muradnagar. Today, I am going to tell you about first aid. So, let's start. Now, the very first question that arises in our mind is, what is first aid? So, first aid is the first and immediate assistance given to any victim of an accident, injury, sudden illness, or any other medical emergency. It uses the available human and material resources at the site of accident to provide initial care to the victim until more advanced care is provided. Now, as we know about first aid, so the next question is, why first aid is important? So, everyone should learn at least some basic first aid techniques, as you never know when you might need them. You could be at your home, or at work, or at school, or on a holiday. Whether it's a minor situation or something more serious, first aid knowledge will give you the confidence to act. You could be the difference between life and death. Aims of first aid. Well, the primary goal of first aid is to prevent death or serious injury from worsening. The key aims of the first aid can be summarized with the acronym of 3 P's. First, preserve life. Second, prevent deterioration. And third, promote recovery. It is very important that at an emergency, you should act quickly, calmly, and correctly. Well, this is very important. These are some items that must present in your first aid kit. First, cotton wool, adhesive tape, crepe bandage, sterile dressing, bandage, thermometer, scissors, gloves, soap, pain reliever, antacid, ORS packets, and antiseptic cream. These things are very important. For action plan, one should remember DRABC. This action plan is a vital aid to the first aider in assessing whether the victim has any life-threatening conditions and if immediate first aid is necessary. D is for danger to you, to others, and to the victim. R is for check response. Check whether the victim is conscious or his or she is unconscious. A is for airway. B is for breathing. Check the victim is breathing or not. And last, C is for circulation. For circulation, check, can you feel a pulse or can you see any obvious signs of life? This is the action plan. So, now as you all know about what is first aid, let's talk about some common injuries or diseases where first aid is required. Strain and sprains are very common but can be dangerous. Strains are the injuries to muscles or tendons due to overstretching, while sprains involve a stretch or a partial tear of ligaments. Strains and sprains happen more often in teens than in younger age. What are the signs and symptoms of strain and sprain? First, pain in your joint or muscle, swelling and bruising, warmth and redness of the injured area, trouble moving the injured part. So, what should be the first aid for this? If someone suffers from strain or sprain, what we should do? Stop the activity right away, and we should think about RICE for the first 48 hours about the injury, where R is for rest the injured part until it's less painful. I is for ice, wrap an ice pack or cold compress in a towel and place over the injured part immediately. C is for compression. Support the injured part with an elastic compression bandage for at least 2 days. And E is for elevation. Raise the injured part above heart level to decrease swelling. Burns. A burn is a damage to the skin caused by contact with dry heat. It may be caused by fire, flames, steam, hot liquid, hot metal, sunlight, electricity, or chemical. So, what should we do if someone suffers from burn? We should immediately immerse the burnt area in cool water. Cover the person with a blanket immediately. Send for medical attention. Remove jewelry and constrictive clothing before swelling or blisters occur. Now, what should we not do? We should never put ice on the burn as it delay healing or cause extra damage. We should not break blisters and attempt to remove the skin as it can cause infection. We should not remove anything that is sticking to the burn. We should not apply lotion, ointments, butter, or fat to the injury. Now, what is bleeding? Bleeding is blood escaping from the circulatory system from damaged blood vessels. Bleeding can occur internally or externally, either through a natural opening such as mouth, nose, ear, etc., or through a wound in the skin. Now, what should we do if a person is suffering from bleeding? We should help the person to remain calm. If the cut is large or bleeding heavily, have them lie down. If the wound is on an arm or leg, raise the limb above the heart level to slow bleeding. We should remove obvious debris from the wound, such as stick or grass. If the cut is small, wash it out with soap and water. After putting on clean latex glove, apply firm pressure to the wound with a folded cloth or bandage for about 10 minutes. When bleeding has stopped, tape a clean bandage and over the cut. Now, what should we not do? We should not remove an object if it's embedded in the body. We should not attempt to clean a large wound. When first applying the bandage, we should not remove it to look at the wound. During this time, it may begin bleeding again. Heart attack. A heart attack is a medical emergency in which the supply of blood to the heart becomes blocked. Often as the result of a blood clot, the blockage is most often a buildup of fat, cholesterol, or other substance which form a plaque in the arteries that feed the heart. Now, what should we do when a person is suffering from a heart attack? We should check for signs of life. Look to see whether the person is breathing, moving, or responsive. We should make sure that arms are straight and we are pushing in the middle of their chest. We should start CPR as soon as possible. Now, what should we not do? We should not waste time. Even if you are not sure about the symptoms, if you suspect a heart attack at all, do not wait, and we should seek medical attention immediately. Snake bite. An injury caused by a bite from a snake. A snake bite can be life-threatening if the snake is venomous. Symptoms may include pain, swelling, redness, or bleeding at the site of the bite. Now, what should we do? We should rinse the area around the bite with water to remove any venom that might remain on the skin. We should clean the wound and cover with a sterile dressing. We should remove any rings or jewelry. We should immobilize the injured part. Transport the victim to the nearest hospital as soon as possible. Now, what should we not do? We should not make any incisions in the skin or apply suction with our mouth. Do not apply ice or any tourniquet. Do not shock the victim with a stun gun or electrical current. In this video, I told you about some basic first aid techniques. Although prevention is better than cure, but if something worse happens in front of your eyes, at least you should not panic and save the victim's life. Thank you.